To introduce Carol Brandt this morning. With decades of experience working with Medicare supplement education and planning, Carol is also affectionately known as the Queen of Long-Term Care Planning and Funding. She's president and founder of Brandt Financial Concepts in Palatine, located not too far from us here at the Elderwerks Center, and certainly is no stranger to our organization. Carol's independent firm, now celebrating its 41st year, like I said before, has been our diamond sponsor for the Elderwerks Aging Better Expo for 3 consecutive years. Again, we are so incredibly thankful for Carol. She is a repeat guest speaker at the Expo and a frequent and fun guest speaker of ours for several educational events per year, such as the one we are all here today for. As one of Elderwerks' trusted professional partners, Carol is a valued resource for Medicare and supplement education, investment planning, and a certified professional in long-term care planning and funding. We at Elderwerks know these matters are all important, and Carol helps us and those we serve to connect the dots very well. Today, Carol's plan for us is to make Medicare and traditional supplement planning simpler, eliminate confusion, and share something new with us. I know that we are all looking forward to that. Please join me in welcoming Carol, our Queen of Long-Term Care Planning, and in thanking her for her continued support of Elderwerks. Thank you, Carol.
Thank you so much for that introduction. And I need to return the favor here a moment, because you guys at Elderwerks do not brag about yourselves nearly enough. Yes, we were the Expo premier sponsor and ended up with on the back page cover for anybody that went there. Elderwerks put out this great program with all these wonderful resources and vendors in here, but they also put out, I hope you can all see this, they also put out this amazing directory that they gave out at their booth. They give out in the center, and this thing is like a phone book, and it's filled with all the resources of organizations and people like myself that support Elderwerks. And in here you'll find estate planning attorneys, senior trained realtors, CPAs. I believe I'm their only long-term care, certified long-term care professional, and other people that are in my business, other financial advisors, other people that handle insurance. And it's just a great place to go. And when the crisis hits, you know, there's no yellow pages anymore, but why Google? Why just ask one neighbor when you can call Elderwerks? Make Elderwerks your first call when something happens, because they vetted scores of home care agencies, nursing homes, assisted living facilities, and they know who the good people are in the business and who's had little turnover and who's got a good reputation. And it's just a great resource, and they are free to adults of all ages, and it doesn't matter about your income. Some of their most frequent flyers are some of the wealthiest people from the North Shore, and more. So with that, thank you. I do appreciate that. I want to say something on the front end. First of all, first slide up here, if you see that, in the bottom left, that is our historic office building. We bought this in 1985 and gutted it and gave it another 100 years of life. We kept the columns and rebuilt the porch the way that it was, added on a 300 square foot 2-story addition. And that is our business home there. We lease out the second floor, but also upstairs we're doing this show right now from our innovation studio, we call it, or sometimes we call it our Zoom room, but that's where we're broadcasting from. So we bought all this equipment and set this up during COVID, when we couldn't meet face to face with people for these larger talks. So this is where we are, and this is where Street Fest is, right out in front of us here. So I want to start with something, because if you're inclined to jump off before I get to that part, I hope you'll stay. This is just something I'm going to share with you. Human biologist and longevity expert Gary Brecka and scientists from the MIT AgeLab, that's the Massachusetts Institute of Technology, where I am a collaborating and contributing member of PLAN, and that stands for Planning for Longevity Advisory Network. Gary the biologist, he said that if we are alive 5 years from today, that we could live to 120 to 140. The reason is that the entire medical system is about to be circumvented in a most positive way. Over the next 5 years, possibly sooner, scientists and BRCA are predicting that we're going to see 3 centuries of medical progress occurring in predicting and preventing illness before it occurs. This will happen as the convergence of big data, AI, and early detection technologies emerge. But first of all, it makes me think, how will we access and pay for these technologies? First, I think of the financial part. It's like, oh my God, if we live to 120, 140, do we have enough assets to last that long? So some of the things we do with our firm is helping people with not only long-term care planning, but the lifetime income. But the other part is, I worry that our bodies aren't meant to last that long, and so maybe we're going to need some long-term care. But then the other thing is, if anyone wants to benefit, then this is important, this is why I want you to stay on. If we want to benefit from the screening and early detection technologies, things like lifeline screenings, if you've heard of that, thermography, there's something new out, Prenuvo, it's like an MRI on steroids, radiation-free. It can detect the tiniest little aneurysm in the back of your head before you even have a headache. And we can survive some of these things by early intervention. Personal insurance, Medicare, and no Medicare supplement pays for this stuff. But there is a plan that we're going to talk about today, just a little bit, because this is education about Medicare and supplements in general. But I am going to talk to you about something that does pay for this preventive coverage. So I hope that you stay on and listen to that. With that, let's go. Okay, Medicare Made Simple. I wanted to do this today because I am frustrated over how people are taught about Medicare and supplements. I had someone come in yesterday. I was her 4th contact. This was meeting number 4, struggling to try to understand Medicare and supplements. And it's not all that complicated, but it's the way it's being presented. And whether it's people in my business or other people that are teaching this in the community through not-for-profit organizations, I want to make it easier to understand. When people leave my conference table at our building there, that they come in for the one-on-one meetings, generally about an hour, hour and 15. By the time they leave, they know what they need, why they need it, what it does for them, and they're able to talk to other people about it. So that's what I hope for you today. What we're going to talk about today, general Medicare basics. We always get a lot of questions about transitioning from private or group medical coverage to Medicare and a supplement. I just want to add here, this was in all of the communications, that this is mostly a discussion regarding traditional Medicare supplements. This is not a Medicare Advantage educational talk, but it will be touched on. So just so you know, I'm going to talk about enrolling in Medicare, the different parts of Medicare, and I'm going to do it so your head doesn't spin. And we're going to talk about traditional Medicare supplement options, and then for something new, as I said, for those interested in preventive medicine. So what is Medicare? We know it's out there. It is federal. It's a federally funded program for seniors and other individuals with certain medical conditions or disabilities. Sometimes people confuse it with Medicaid. Sometimes they really confuse it with Medicaid, but sometimes we just do that verbally where we mean to say Medicare and we say Medicaid. Medicaid is also a federal state health insurance program for people with limited resources. So the basics of Medicare, a little history. It began in 1965 and it's run by the Centers for Medicare and Medicaid, call it CMS. It's primarily for seniors. Was modernized with the Medicare Modernization Act of 2003. And then there were more changes with the Affordable Care Act. If we were in person, you could get from me one of these books, but the other one is in PDF only. So if anyone would like the Medicare and You booklet, we have the PDF and we can send it, or choosing the Medigap policy. And Medigap is used here, maybe, hopefully for the only time. Mm-hmm. I call it Medicare supplement, but sometimes the government still throws that Medigap word in there. So that's what that's what it says on the book. So they're calling it Medigap. But it's another word for Medicare supplement. So Medigap and Medicare supplement are used interchangeably, but not too much. We're going to talk about the different parts of Medicare. There's A, B, C, and D. Let's just make it simple. Part A is the hospital. Part B is everything else. Just keep that in mind. And if you were sitting with me, I would hold my hands up in the air. You can see it here like a loaf of bread. Remembering that Medicare pays 80%. of everything, and the supplement pays 20%. So if you can clear your mind of anything you think about Medicare and supplements and all the parts, forget it. Medicare pays 80%. Here's the loaf of bread here. The supplement pays the 20%. And Medicare has an unlimited, that 20% is unlimited. So it's important to have a supplement to pick up that 20% because it could be 20% or $400,000, and that could be tough to chew. So Medicare's got A, that's the hospital. B is all other. C is when people talk about Medicare Advantage plans, and I will stick our toe in the water just a little bit here. And part D is for the drugs. That's easy to remember, D for drugs, right? Okay. When should you enroll? If you or your spouse are currently working and you receive your health insurance through an employer, you do not have to enroll in Medicare at 65. A couple was in yesterday that had been coming in for the first time with me, but had been to 3 meetings. All the neighbors and all the friends at work, oh, you got to enroll in Medicare B, you're going to get in trouble. Like, I asked him, I said, do you have, and we'll talk about this, but do you have a health savings account? Because he's going to continue working. He says, yeah, I do. I said, you don't want to enroll in Medicare A because it will disqualify you from your HSA. So we'll talk about that a little bit later, but you've got to be careful listening to friends and neighbors tell you to do things when it comes to Medicare, Medicaid, Social Security, because you might do the wrong thing. Talk to an independent person like myself and get the or Medicare and or Social Security and get the right answers. So the first one, if you and your spouse are currently working, you don't need to register. You don't need to enroll in Medicare. When you and your spouse retire, regardless of your age, you're going to be like a new kid. You haven't blown your opportunity. You'll be a new kid on the block because now you're just going to enroll in Medicare A and B without penalty because you were deemed ineligible before, if you wanted to be ineligible, because you stayed on your employer's plan. Let's think about this. Sometimes I'll have people call and say, I'm turning 65, but I have group insurance. So it is good to sit down with someone like me ahead of time, because if your employer is paying for or subsidizing your group coverage at work and you're 65, you need to take a look at your costs for enrolling in Medicare B, which is with Medicare, which is tied to your income, because maybe you and your wife are at your highest income ever, and your joint income is what determines what you'll pay for B. And then you have to think about the fact that the employer is subsidizing, sometimes 50, 60, 70, 80% of your premium. So you might spend more. So I send a lot of people away back to stay on your group plan, see me when you're ready to retire. So don't just jump and assume that you need to enroll in a supplement because you're turning 65. If you're working, enjoy your employer-sponsored plan. So when you or your spouse retire, regardless of age, you'll have a special opportunity to enroll in A and B without penalty. Don't need to worry about that. If you need medical coverage for your spouse and family, this is important. Medicare does not cover family members unless they qualify on their own. So in most cases, turning 65, right? If your spouse is under 65, that spouse would need to maintain separate individual coverage or group coverage where they work until they're 65. Same for a dependent child. You can't go on Medicare and say, take my 22-year-old with me. That they have to be covered under individual major medical plan, not Medicare. So Medicare alone, I said that if you saw the loaf of bread there, Medicare paying 80%, that 80% is not enough. Part A and B have no yearly cap on the out-of-pocket costs, so that 20% that Medicare doesn't pay could be a big chunk. I have run into people, been in business 41 years, a rare occasion that only had Medicare, and one of them ended up $400,000 out of pocket on a cardiac-related thing. And then I know someone else that didn't have coverage. It was a doctor, and he ended up he was a radiologist, self-diagnosed himself with cancer and said, you can't help me, can you? Well, there is one company that, regardless of your age, will take you at any time for a traditional Medicare supplement plan, at least under current standards, and it's Blue Cross. Blue Cross isn't necessarily the lowest cost plan out there, but they consider themselves a not-for-profit organization, and they do not ask medical questions unless you want to go through underwriting and get a little bit lower rate. Then you can go through an underwriting process. But I was able to write coverage on this doctor on, it was like the 27th of the month. the first of the month, I got a plan in place for him, and it paid for the cancerous removal of his lung. So we were able to do something for him, and there was no open enrollment. There was nothing special going on. He was 69, 70 years old. So there are things we can do. So don't feel that all is lost if you are sitting there without your 20% being covered by a supplement. There is help for everyone. Options that pay for medical expenses. What have we got? So we've got original Medicare and a Medicare and a supplement. So original Medicare, we'll call that the 80% and the supplement the 20%. Here comes Advantage, privatized. When you enroll in, we'll talk about this a little bit, when you enroll in the Medicare Advantage plan, you're actually still paying for Medicare Part B, but you're giving up Medicare and letting Medicare assign those benefits, those dollars over to Humana or Aetna or whomever. And so now the insurance companies calling the shots. Not for me to judge, just most of the clients I deal with value choice. They want to pick doctors that they'd like to go to, and you're going to see more about that in a bit. Then there comes prescription drug expenses. When you have an Advantage plan, they build the drug plan in there, but then you're kind of stuck with whatever plan everyone else has. When you have Medicare and a supplement, we shop out the drug plans based upon the exact drugs you're taking and the pharmacy and your zip code and all that, and you end up with the plan that is paying the lowest, where you have the lowest out of pocket for the coming year. And then that's something that gets looked at every year because drug categories and plans change. Medicare supplements and Medicare Advantage plans are not the same. It is apples and oranges. It is not the same. So know that. I had somebody at the expo tell me that was marketing Medicare Advantage plans that he calls them partial plans. And he sells supplemental insurance on top of that, hospital or chronic disease plans that pay a lump sum when you get the diagnosis, because he says Medicare Advantage plans are his bailiwick, but he considers them partial plans and that people need other insurance on top of that because of the gaps. That was his words, not mine. I'm just sharing. Enrolling in A. Okay, A is hospital, right? This is Medicare now. We're not talking about insurance yet. We're talking about Medicare. You're automatically enrolled in A if you're receiving Social Security benefits when you're 65. If you're not enrolling in Social Security and you're 65, you opt for A if you want to. It's free if you've worked 40 quarters in the United States, and the FICA taxes pay for that. If you don't enroll in A when you're first eligible, there can be a penalty. And eligibility, when is that? Is it when you turn 65? No, it's when you stop working and are enrolling in A and B. If you're not receiving Social Security benefits and you're 65, you should sign up for A. It's free. You might as well by calling Social Security or going to ssa.gov, and there's a phone number there. And then consider delaying, not consider, do delay enrollment in A. If you're contributing to a health savings account through your employer, which is pre-tax, if you have A, because A is considered first dollar coverage. And so the whole idea behind a health savings account is that you have a high deductible compatible plan. So you will not want to enroll in A and disqualify yourself. And sometimes, and I wish this was a finite answer, I've had people tell me that they've enrolled in A, and that when they were beyond 65, that Medicare went back and backdated their A effective date 6 months prior, which really messed up their health savings account contribution, and they could not then they had to back it out, and their HR department charged them $150 for making the changes. So just kind of think about that. Don't rush into anything, and you can of course call us or someone like us or any of these organizations to ask questions. We just don't rush into anything. So here now, enrollment periods. So let's take a look. Did I skip a slide here? Let me just go back. Okay, here. Enrolling in Medicare A. If you decide to enroll in A, there are times you can sign up as follows. There's your initial, there's general, and special. Don't let that make your head spin, because on the next page, we're going to define that. Initial IEP. I don't ever call it IEP. I call it initial. It's a 7-month window when you can enroll in Medicare Parts A and B. It's 3 months before your birthday month, and 3 months after. So that's a total of 7 months. Most people call me when they're 6, 7 months out from turning 65. And we can have a question here, but I'm going to finish this slide here so I keep us on track. So there's that initial enrollment period. Let's say you're not working, you're covered under individual medical insurance. You're going to want to pay attention to this. So 6, 7 months ahead of time, talk to somebody like me, look at your options, get your costs, compare the plans, and see what you'd like to do. Then there's that special enrollment period underneath that. That's triggered by a special circumstance that lets you register without any penalty. That's when your other insurance is ending, or you change address, you've moved, maybe from another state, or your current Medicare plan changes or ends. That doesn't happen with traditional, but it does happen where people move from another state and had an Advantage plan, so that's an opportunity for them to come in, or their Advantage plan is discontinued, or doctors and hospitals fall out of the network. Then there's a general enrollment period. We're not talking about Medicare supplements now. We're strictly talking about enrolling in Medicare A and B. So that general enrollment period happens annually between January 1 and March 31st. If you're quitting your job or retiring, you don't have to worry about general enrollment because you've got your initial. When your coverage ends, you've got the opportunity there. So general enrollment during this period, you can switch or leave Medicare Advantage plans as well as enroll in Medicare. There may be a late enrollment penalty if you've not done it according to plan. I'm going to stop here and go to the question because I heard the bell.
The question, will you be sending out this PowerPoint?
It's my understanding that this is being recorded. This is a huge file, and that Elderwerks is recording it, so you'll be able to, Kristen, am I correct there? It'll be accessible?
Yes, it will be recorded and it is going to be posted on our YouTube channel. So you will know when that gets posted.
And if there's any slide or any questions that you have, be happy to communicate with you if you allow that. Okay, Katya, is there something else?
Yes, there is. Linda asks, we heard that the age will be changed to 67 instead of 65.
67 on retirement age, but I haven't heard how that impacts supplements in that. So yes. Going to the next slide here, enrolling in B. If you're receiving now, if you're receiving Social Security benefits, you're automatically going to be enrolled in B, and that's going to begin the first day that you turn 65. So open enrollment for a Medicare supplement. Remember, that's 6 months following enrollment in B. So when you enroll in Medicare B, you've got open enrollment to buy anything you want, enroll in any Medicare supplement plan you want without any medical questions. After 6 months, we have to worry about our health, except with Blue Cross and except with Medicare Advantage plans, for which you need to wait until enrolling for effective the first of the year. But if we're talking traditional plans here, the 6 months following your enrollment in Part B is a very important period of time, because that's when you can have anything you want with no medical questions asked. We just actually draw a line through the questions, don't care about your height and weight. In some cases, we don't care about your smoker status, don't care about the medications you're taking, and you can have anything you want. When you get into the 7th month, if you say, oh, gee, I shouldn't have enrolled in a Medicare Advantage plan, or I enrolled in a plan that doesn't have these preventive wellness benefits that Carol told me about, and you want to enroll in one of those plans, there's going to be some questions. Under age 69, there's less questions. Over age 69, there's more questions. So we want to choose wisely during that first 6 months when we're turning 65. If you're still working and receiving Social Security benefits and do not wish to enroll in B, sometimes the card comes anyway. So there are instructions that come with your red, white, and blue Medicare card to return it and stop B, because B has a charge to it. B has a cost that we pay Medicare for it. So we don't want to be paying for it if we're still working and paying for or enjoying employer benefits. So next slide there. Katya, did I skip one? Excuse me here. Okay, I mentioned there the general and the special again, and I'm going to repeat it here. There's that general and special again. So again, general between January and March 31. Do you need to worry about this if you're still working, if you're not 65 yet? No, just during this period, you can switch or leave a Medicare Advantage plan. That might be important to you. But if you're beyond your 6 months, then you might have to answer medical questions. The special enrollment period, that's going to be triggered by you lost your coverage at work, it ended, you moved, changed your address, moved out of state, your Medicare plan that you were on had some changes to it, and that generally only occurs with an Advantage plan. So we're going to take a look at Medicare costs here. And this is a sheet that's required to show you, but I'm not going to talk about what's included in the under A and B until we get to another document, because that's where I make it easier to understand. So just here we are with A again. A is free, and it could cost you as much as $510 a month if you weren't working in this country and you needed to buy in, but that doesn't apply to most people. Part B does have a cost to it, and for most people, we're going to look at the cost on another document. But Social Security keeps a tab on what we pay each year because they're looking at our income, and I'll show you the chart that's coming up. Here are the 2025 Medicare costs for B. Remember, A is free, right? So Part B has to do with our modified adjusted gross income as reported on our IRS tax return. Now you're seeing the year 2023 on here, and it's not because my documents are out of date. It's because 2023 is the year that's used in calculating what we pay. So up at the top, up at the beginning there in the light blue box, if you file an individual tax return and your income is 100,000 or less, over to the right, Part B costs $185 per month. And if there's 2 of you in the family, it's 185 times 2. If you're filing a joint return of 212 or less, it's then 185 for that. And you can see the married separate return. So above 106 to 133, that cost goes up to 256. That's a big jump. So it's good to sit down with someone like us to do your planning there. Why? Well, maybe you've got rental income. Maybe you've got unearned income. Maybe you've got other income that could be delayed to keep you from going into that next into that next segment. So not manipulating your tax return, but ways that you could keep your income down if maybe you're self-employed and you can route things or delay them to another year, to the next year, for example. It can perhaps help in what you're going to pay there. As your income goes up, you can see that when we get to the 200,000 and less than 500,000, or above 4 and less than 7, we're up to 581. And then when you get down to that bottom level, who's paying that kind of thing? Well, there are people out there in that income bracket, and some of my physician clients, many of my physician clients, and they can afford it, but it is a lot. So some people who are supported by their employer plans continue to stay on their employer plans where one spouse is retired and the other is still working, so that they can take advantage of not having to pay this $628 or whatever there is in that far right column. So 185 is going to be the minimum. There's no going around that. It seems like yesterday it was 130 and there is an inflation factor, and that does go up most years. So that's the way that it is. We go to the next page here. Okay, now we're going to take a look at yes,
One more back.
go back one more.
Yes, Part D.
Oh, excuse me. That looked like the other slide. This is the Medicare cost for Part D. Thank you for my trusty assistant being here, bringing that to my attention. Part D, the drugs. Remember, D was for drugs. Part D does have a cost factor too. It's a little bit different. So this is now if you don't enroll in a Medicare Advantage plan and you buy a traditional Medicare supplement, you buy your drug plans separately, and you get your choice of drug plans and pharmacies, etc. So if we go to that first level there, individual tax return of 106 or less, or joint 212 above, the cost is 0. There is no cost to give to the government to enroll in a drug plan. All you're going to pay is the premium to the insurance company. So just one thing here, Medicare sometimes uses the word premium and sometimes they use the word cost. when clients come in to see me, I tell them, when I say the word costs, I'm going to be talking about Medicare. Let's talk about Medicare has costs. And when we talk about insurance, we'll use the word premium. Sometimes that helps us keep that straight in our minds. It certainly helps me when I talk about it. So the cost for Medicare, if you're 106 or less or 212 or less joint, is $0. You're only going to have a premium. Now, you haven't seen that yet. We haven't talked about insurance yet. We're only talking about Medicare. We go to the next level at 106,000 or less or joint 212. The next level, 106 to 133 or 212 to 266. Then comes in a cost. $13.70 is the cost plus the plan premium. As we go down the line, you can see that the cost for Medicare to have a drug plan, to be enrolled in Plan D, can be as high as $85.80 plus the insurance premium. The insurance premiums are small compared to some of these rates here. So you'll see when you enroll, but they can be anywhere from $0 to, I've seen some maybe as high as $35, but for the most part, the premiums are small for the drug piece. Oh, excuse me. There we go. Okay. Medicare supplement plans. What we're looking at now is the world of Medicare supplement plans. This is not any particular company's plans, but this is what the government says we have to choose from. A number of years ago, they standardized all the plans. So if you have a plan G, for example, with Blue Cross, it's identical in the core to Mutual of Omaha, Physicians Mutual, United Healthcare, Humana. Why is that? But they're priced differently. Well, so is corn and peas at the grocery store and gasoline, depending upon the brand and the gas station. So, but to know this, that when you go from company to company, the core benefits must be the same. So here we have the alphabet soup, A through N. And over to the left, we have the components of it. Plan F, which was previously the best and most popular plan. You can see that there, and also a FHD, which stands for Plan F, high deductible. Those plans are no longer available if you turn 65 after January of 2020. If you have an F, because you turned 65 and the Fs were available, you can buy another F. You can apply for another F if you can medically get in and maybe save some money by moving plans. But I have to tell you, most of my life, most of my career was spent working with the G plan. The G plan deductible is now $257, but years ago it was $100 or maybe a little more than that. And the savings though, so the only difference, you can see the 257 written in the G column and the GHD, which stands for G high deductible. The only difference between F and G, because the core benefits are identical, right, is the $257 deductible. But the savings, I had somebody in their late 70s come in and move from F to G, and I saved them $1,800. What was the risk? Just $257. They picked up a $257 deductible each and saved nearly $2,000. Who wouldn't do that? I'm more investment oriented, so I've always educated people, hey, look at this G. So nothing to be afraid of. G is what's available there now. I'm going to take you down to the second line of text at the bottom. You see a number of $2,870. That's the high deductible. If you had a GHD or a FHD, that's the deductible before the policy pays anything. So there are some plans that have been discontinued. The most often you'll be looking at a G or a high deductible G, or something that's not on this chart is with a particular company as an innovative G. And we'd talk about that if we were meeting together, but it's pretty cool. It's a 25 to 35% less in premium, and the deductible goes away at the third calendar year. So we could talk about that one-on-one because there's a lot to unpack here, and I want to make sure I give you the basics. Let's go back to the standardization. But wait, you heard that a plan has a vision discount, or maybe a health club included, or maybe some hearing aid discount. Yes, companies can offer, we call them bells and whistles. Companies can give you more, but they can't give you any less than the core benefits. So you might find some companies that have some bells and whistles, some additional features, but the core every plan G is exactly the same core benefits. It will not vary an iota from one company to another. Blue Cross, Mutual of Omaha, Physicians Mutual, Humana, AARP, everyone, United Healthcare, everybody's plan will be identical in the core coverages that it has. Medicare pays like lightning, your supplement pays right after. That's just the way it goes. Nothing to worry about, and you'll see. Okay. This is a part where I'm going to deviate from this and go to another page to explain what's included in hospital and what's included in all other, but just reinforce here. Part A benefits are for the hospital. And I'm going to skip this because we're going to see something else that makes it a lot easier to understand. You do not need to memorize these things here. Part A continued goes on and includes skilled nursing facility and what Medicare pays and doesn't, but I'm going to show you something much easier to look at on another chart in a moment. Part A goes on there, then Part B. These are the things that are covered under B, and we're going to talk about that further, but there's a welcome to Medicare visit. There are very limited preventive services. This part covers the inpatient and outpatient doctor visits, surgical services, supplies, speech and physical therapy, diagnostic tests, durable medical equipment if you need that, and ambulance services. So A is hospital, B is everything else. Let's talk about this just a minute here. Welcome to Medicare visit. This is a one-time review of your health, and I had a nurse tell me that it was a touchless exam, that you're going to get a blood pressure cuff put on you, but there's really not much done in this welcome to Medicare visit. They're going to ask you if anybody's abusing you at home and do you fall much and things like that, but it is not a physical, it's unfortunately not a physical exam. There is an annual wellness visit, but she honestly called it a data mining exercise. The doctors are going to ask a lot of questions in order to accumulate diagnosis codes. And there just isn't a lot done in that wellness visit. If you have a traditional Medicare supplement and you don't have the one I'm going to tell you a little bit about that has the preventive benefits rider, you just don't get much. It is provided free. One time every 12 months, and it's not subject to the Part B deductible, but it is not a physical exam. If you want some of all those lab tests that determine the cardiac markers, and maybe ladies want that CA-125, it's got some markers for ovarian cancer, which is a silent killer. There's other preventive things that we'd like to do. You can't do it unless you pay for it. And some of the doctors, I'm being told by clients, that the doctors won't even order them, even if you want to pay for them. The answer is no, we don't do that. So you've got to have a plan that has that preventive benefits rider on there and convince the doctor, like, hey, I have coverage for this, if you have such a plan. Oh, okay. Part B on preventive, again, Medicare will pay for some, but not all preventive services. The doctor might recommend some more frequently, but it's got to be necessary, medically necessary. So here we get one time only abdominal aortic aneurysm screening. But on my plan that covers the preventive benefits, you can go for lifeline screenings as often as you want. Breast cancer screening is once every 12. There was a period of time where they tried to take that away, and if you were over a certain age, and make it 24 months and 5 years, but it's back now. Cardiovascular disease screening once every 5 years. Those are some of those sophisticated labs that I like having to stay well, but it's only once every 5 years. The colonoscopy, this to me is insane. You get a colonoscopy, it's negative. We don't want to see you for 10 years. Well, my goodness, what if you got a polyp the next year and it turned cancerous in 3 or 4 years, but the doctor's not going to see it for 10? So the plan that has the preventive benefits rider, you can, not that we want to have a colonoscopy or enjoy it or look forward to it, but if you wanted to have one in 3 or 5 years because you didn't want to wait 10, like I wouldn't want to wait 10, you can do that. You can have, that's a screening process, and it's covered by one plan. And then flu shots once per season. So Part B details, there is a $257 deductible, and after you meet that deductible, Medicare pays 80% of the covered charges, And you do get 100% for the blood tests and the diagnostic tests and various amounts for preventive services. And we're going to talk about excess Medicare approved amounts, because without a supplement, you don't have any coverage for excess, and I'll explain that when we get there. But really, the only out of pocket, pretty much, if you have a supplement in Medicare, is your $257 deductible for medically necessary things. So that's a big change from where you're coming from. Maybe your employer-sponsored plan with $1,500 is a luxury these days, but most plans are $2,500, $5,000, $10,000 deductibles we're seeing with the group employers. So this is a welcome change. And by the way, did I tell you with a traditional Medicare supplement? No, I didn't. You have a choice of any doctor, any hospital in the nation. No mother may I, no referral slips, as long as the doctor accepts Medicare. And if the doctor doesn't accept Medicare, you've got a plan, if you have a supplement, that pays for the excess that the doctor might charge over and above. And it's 15% in Illinois. We'll talk more about that. So this is the part where I say, forget those other charts. Sit here with me on this. This is on one piece of paper, or two pieces of paper when I'm sitting with someone at the conference table. So bear with me here, but you're going to feel so much better about all this. Here we are, Medicare Part A, plus the insurance. We're going to look at now what Medicare pays and what the supplement pays. And we're going to be looking at plans G and N here. G, the most popular, N is not popular, but it's very similar to G. And if I didn't have that on there, you'd be asking me about it. So first of all, this is hospital now. There is a deductible on the left. Guess what? Medicare pays nothing of the hospital deductible, which is $1,676. But if you have a supplement, the plan pays the $1,676 and you pay zero. Follow me to the next line. The first 60 days in the hospital, all but $1,676. The plan pays the $1,676, you pay zero. 61 through 90, all but $419. The plan picks up the when it says plan means supplement. Medicare is Medicare, plan is the supplement. Looking at G or N now. All but $419 a day, you pay zero. 91 through 50, you must be very sick. That's a lot of days in the hospital, but did we not see that? Did we not see that kind of hospital stays with COVID? Some of us did, yeah. Not us being me, but we saw people. All but $838 a day, the plan picks up the $838. What's the patient paying? What are you, the policyholder? Nothing. All I see is zeros down the right side of the page. No worries. Extended hospital stay. What is that? Well, up to an additional 365 days, because Medicare doesn't pay anything after 150 days. But if you have a supplement, look at the third column, the plan pays 100% of the eligible expenses and we pay nothing. Everything hospital here is zero out of pocket here with Medicare and a supplement. How nice is that? To the next page, it's the same page if you were sitting with me. They break out a benefit for blood. Medicare pays all but 3 pints. The plan picks up the 3 pints, we pay zero. Skilled nursing facility. This is a stop sign here. This is not to be confused with long-term care. This is if you need a skilled nursing facility following a hospital stay, you've had an accident, a stroke, hip replacement, skilled care. This is not for non-medical care. This is not to take the place of long-term care. Medicare pays 100% of that first 20 days. If you need skilled care, the plan pays zero because Medicare is paying 100%. You pay nothing. Skilled nursing facility, again, skilled care, delivering rehab services, wound care, something that a skilled professional needs to be there for, not just a neighbor, friend, or a non-registered caregiver. 21 through 100 days max. Medicare is going to pay all but $209.50 if you need skilled care, if you've been in the hospital. The plan picks up the $209.50 a day and you pay zero. But most people, by the time you get to 21 days, many people are told you don't need skilled care anymore. You need custodial care because you had a stroke and you're trying to get better, but you really need to be cared for at home or in a nursing home where you need custodial care because you don't need a skilled nurse anymore, and we're on our own to pay. Hospice outpatient drugs are referenced. Medicare pays all but a very limited copay. Plan picks up that copay, patient pays zero. Look at our right side again, all zeros. I'm going to stop for that question after this last slide, after this last piece here. Hospice inpatient care, all but a limited copayment. It used to say $5 there, and now it doesn't anymore, but it's about $5. The plan picks up that copayment and patient pays zero. So we've been talking about Part A here, and we've been talking about having Medicare and a supplement, and so far the only thing you've seen is zeros. Yes, for the question, please.
Linda asks, is this coverage per admission, per year, or for your lifetime?
The hospital deductibles, once you've had 60 days without a hospital stay, can occur again, but with a supplement, it's picked up. So that 257 though, that's an annual deductible. So once you see the doctor once or twice, you're kind of chipping away at that 257, and as soon as that's paid, then that as soon as that's satisfied, then you're in 100% land. So we're still on this now Part B part. We're starting Part B. So now we're talking about Medicare, which is the B part, and having a supplement of G or N, just like we did on the A section. Every year there's that deductible. Medicare pays nothing towards the deductible. The plan pays nothing towards the deductible unless you've got an old F plan. But the deductible is only $257, and that's for 2025. It could change next year. After that, 80-20, just like kind of what we're used to maybe with our group insurance or the old days. Plan picks up that 20%, and what are we looking at? Another zero. Let's talk about Plan N a minute. Plan N is a lot like G. There is that $257 deductible and 20% coinsurance, but there is a $20 office visit and a $50 ER visit copay, but there's more that it's missing. So it is a little bit less expensive, but you have to pay $20 every time you go for a visit and $50 for the ER visit, but there's more. Plan N doesn't cover excess. Plan G for excess benefits, and what is that? That is up to 15%, that's what Illinois allows, that a non-Medicare doctor could charge. So even though they're not accepting Medicare, they're still capped. The government still caps them by 15%. So if you have Plan G, when it comes to that excess benefits, you've gone to a non-Medicare doctor, Medicare is not going to pay anything of that excess. They're only going to pay per the scale. But your plan is going to pick up that 15% up to Medicare's limit, and there's another zero for us. Excess benefits with Plan N, on the other hand, Medicare pays nothing, as we saw, same with G, but Plan N doesn't pay anything for excess. So when you see a few dollar savings between G and N, and you've got a $20 copay and a $50 ER visit every time you go to the doctor, and then having this wild card like, oh gee, what if I have a $400,000 15% to pay? I don't have anyone, I have no clients. I've been doing this for decades, and I don't have any clients that have an N, because you pay all costs of that excess. They break out a benefit for blood, all but 3 pints. The plan pays the 3 pints, and there's another zero. Emergency care outside of the US. Medicare, did you know this? Medicare pays nothing outside of the US. Nothing. Only if you have a supplement will you then pick up 80% to a lifetime maximum of 50,000, and then back bottom left after a 250 deductible. That's different from the 257 deductible. This deductible applies to that 250. And then we pay 20% and anything over 50,000. So you leave the country, you call me or somebody like me, or make sure that you have something really good lined up, a global travel plan with your travel agent. So we have a really nice one, and I tend to tell people, go check with your travel agent, go ahead, and 90% of the time, 99% of the time they come back, because it covers more than just the medical. It covers bringing your loved ones to you, evacuation. There's an 800 number. They speak all languages. You coordinate your care. It's, God forbid you die somewhere, very difficult to get a body out of a country. There's a lot of moving parts, and they coordinate all of this, and it works really well. So just call somebody, but just know that if you have Medicare and a supplement, you've got a cap of 50,000, and I can guarantee you there are certain cruise ships and situations where people have been charged $50,000 just to get evacuated off of a cruise ship. So that's nothing. 50,000 is nothing when you have a crisis. So you still need, you need more. And what it will pay, it'll pay whatever Medicare doesn't pay. So the global coverage is not very expensive. And you buy it by the number of days you're going to be gone, and it's based upon where you're going. And if you tell me you're going to a war zone, they might not write the coverage or charge extra, because like Mexico, all of Mexico is considered a war zone. And I know people still go there, and there's lovely places in the country to visit, and they feel safe, but it is considered 100% war zone. And there is, if you want coverage for, you know, some grenade being thrown into a, you know, group of people and it's considered an act of war, you got to pay extra for a rider to cover you there, because it is a high risk destination. And we can tell you the high risk places if you need to know. Moving on to the next page, this is small print, and this is something I'm happy to email everyone. This I use a lot during my long-term care talk, but also need to use it now because it's talking about, we talked about that 100 days of skilled care coverage being paid for maybe by Medicare, but half of the people that come in to see me for their Medicare supplement education think that falsely that long-term care coverage for non-medical care is covered by Medicare, and it's just not. So there in the top left there, you see the 0 to 20 days and the 21 to 100 paying, you know, being paid for by Medicare if there's been a hospital stay, if you need skilled care, and that's that skilled professional. And then underneath that, assisted living, nope. Continuing care in a retirement community, no. Adult daycare, not covered. Limited home care, private Medigap or Medicare supplement, it's going to pay if Medicare pays for that skilled care, but everything else does not pay, not covered, not covered. Medicaid, you don't want to be there. You've got to spend down in most states to appear to $2,000. And you can see a lot of not pay there. What are we left with for long-term care? This is non-skilled care. As we age, might have an accident, have an extended hospital stay where we need someone with us. We can no longer be left alone. We're pretty much left to pay on our own. So long-term care planning is essential to do while you've got your health to do it, and before the crisis, so that you don't have to get ready because you are ready. Here, and here's the shock. Yes, personal medical insurance, group coverage, Medicare, and supplements never pay the cost of non-medical care. Medical care, Medicare may pay for that short term. We saw that on prior pages, and I'm repeating this a lot, but I want these things to stick because I want you to end here with me and know what you have and why you have it and what it does for you, and be able to talk to someone else. You saw a lot of zeros, just a $257 deductible. We need to plan for long-term care because only skilled care is covered if we need rehab, pain management, wound care. Medicare never covers the cost of non-medical long-term, or some call it extended care. And yes, 50% of the people have that shocked look on their face. Don't be one of them. What else does Medicare not cover? A and B doesn't cover routine dental, vision, hearing, and foot care with a traditional supplement. Long-term care, which is nursing home, assisted living. Healthcare outside of the US is limited, 50,000, that's nothing. Alternative medicine, elective cosmetic surgery, personal care, prescription drugs, non-medical expenses. Medicare doesn't cover these things, but it covers a lot. You saw a lot of zeros there. Why do we need global coverage? Talked about that. Medicare pays $0 for emergency care outside of the US. Some supplements have a separate foreign travel deductible of that $250 that we saw and pay 80%, but that cap of 50,000. We pay 20% and anything over 50,000, and it just doesn't go very far. You're in another country, we're like, you know, like take our passport and our credit card and, you know, until we pay up. And I know people that have come back 50 to 100,000 lighter in their wallet and credit card because they didn't have, you know, before they met me, they didn't arrange for this ahead of time. Global medical pays what Medicare and supplements don't pay. So it's important to have that. Part C, Medicare Advantage plans. We're going to talk just a little bit. Once you're enrolled in Medicare Advantage plan, you are removed from original Medicare. The profile of people that I see that are on Advantage plans, the income level is about 35,000 or less, although there are some with more and they're happy with it until they have a claim, until they get sick. And then oftentimes they want a traditional plan. So your Medicare benefits and decisions are assigned to an insurance company. Your red, white, and blue card is no longer active, and the Medicare Advantage plans are now prohibited from using the red, white, and blue card in the Medicare Advantage advertising. Lionel Richie, I guarantee you he did not, and Joe Namath, they were not insured on a Medicare Advantage plan, and their ads have been pulled because they weren't. They're marketing other products now. There's network restrictions. It can be limited by county. I had someone in Palatine move to McHenry. He couldn't afford his apartment anymore, staying in a house of someone that let him stay there while they were traveling abroad. He went to fill his prescriptions. His Aetna Medicare Advantage plan and his drug plan was canceled on the spot because he moved out of Cook County and he was giving an address of McHenry. I was able to get him on a Blue Cross plan, but he had to wait till open enrollment to get his meds covered, and it was hundreds of dollars. So don't be that person. Out-of-pocket costs can change over time. Purchasing a Medicare supplement to cover these extra costs, provide access to non-network doctors is prohibited. So you can't have both. You can't go and get yourself a free Advantage plan and then go purchase a supplement too, because you have to assign your Medicare benefits over to the insurance company. So Medicare Advantage plans are Medicare replacement plans. They're not supplements, and Medicare is no longer involved. People don't realize that sometimes. Need to talk about that. Those people that are marketing those plans need to tell the whole story, and sometimes they don't. And I'm sorry, that's people in my business, and that's embarrassing, but you're not going to find that here like that. So here's something else. This was something provided to me by my cousin, who was turning 65 and had been a breast cancer survivor and had been to Mayo Clinic. It saved her, and a couple times actually. But this letter was sent out recently. It said the whole thing wouldn't fit on a page, but you're receiving this letter because you're nearing your 65th birthday, a time when you may be looking at your options for Medicare. At Mayo Clinic, our patients are the center of everything. You're important, blah, blah. But the big print, Mayo Clinic in Rochester is not in network with most Medicare Advantage plans. We want to be sure that you're aware that Mayo Clinic will not schedule appointments for patients with out-of-network Medicare Advantage plans. Later on, it goes on to say that they are not in Rochester contracted with any Medicare Advantage plan. So you could say the same probably with MD Anderson and Cleveland Clinic and those other places. That's not places that we can just pick up the phone and go if we are in an Advantage plan. So if you travel, if you plan to move, if you're a snowbird and you go out of state a couple months a year, then I would consider a traditional plan so that you have all your choices and you don't have to ask anyone's opinion or permission. Next here, drug coverage. Okay, drug coverage is run by private companies and approved by, they're under contract with Medicare, and that helps cover the cost of prescription drugs that are not delivered in the hospital. Things that are delivered in the hospital are part of your hospital bill sometimes. But a drug plan will help lower your prescription costs and protect against high costs in the future. Part D doesn't cover non-prescription drugs, weight gain or weight loss drugs. There are some coverage for medically necessary weight loss if your BMI is over a certain amount. So, but this is a slide I needed to put in there. It doesn't cover fertility, cough and cold remedies, hair growth, cosmetic, most vitamins and minerals. So, moving on from there, I don't know what I do without this chart. It used to be more complicated, but basically there's a $590 deductible for drugs in 2025, except some drugs have no deductible at all because of the class of drugs that they are. So if you only had a $25 drug, would you pay $590? No, you'd pay $25. So you're not forced to pay $590. It's just that that's the deductible for some classes of drugs. After that, your share is 25%. Until the out-of-pocket reaches $2,000, and now $2,000 is the cap. So there's no more donut to talk about. $590 deductible. In most cases, there's a deductible doesn't even apply. We then pay 25% of the next phase, but no more than $2,000 out of pocket. And then it's going into catastrophic coverage. So it's nice and simple now. No more donut. Okay, here's looking, that was a chart. That was, normally I have these side by side, but there's that orange again, there's that $590 deductible. We pay 100% of that if our drugs fell into that category. After that, we're going to pay 25%, but no more than 2,000. So keep it simple. There's some notes there for those taking insulin. Approved insulins are no more than $35 for a 30-day supply until we reach that 2,000. Insulin needs to be covered on the plan's formulary list of drugs. I guess there's different types. Insulin through an insulin pump has a $35 max copay, and that goes through Medicare B, not the drug plan. So sometimes things are not covered and they are covered under B. So that's case by case. We don't know about that ahead of time, right? So late enrollment in D. All right, I'm turning 65, let's say, and you are not taking any drugs. And you say, why should I bother enrolling in a drug plan? I'm not taking any drugs. I'll wait until I get assigned some drugs. Well, what if it happens in June and you can't, and you maybe had an organ transplant and now you need $1,200 worth of meds each month, anti-rejection medication, and it's expensive. And now you can't get in a drug plan until open enrollment. So that's not good. But if you choose not to sign up, there's going to be a penalty. The penalty isn't just a one-time fee. It's added to the cost of your drug plan each month. And that's calculated from the time you went without drug coverage. I had someone in her 80s that didn't take any, not a gray hair in her head and not a medication to be taken, but she did have a stroke, and then she's on a very expensive blood thinner, and she had to wait till open enrollment and had a huge penalty. It's calculated by taking 1% of a national drug-based premium, I'll show you that, and multiply by the number of months since you became eligible and didn't have it. For her, it was 65 to 86 or something like that. So lots of months. Here's an example. So Tammy waited 2 years, 24 months after becoming eligible. She then gets a drug plan with a monthly premium of $20.90. That national base that they base the premium on, the base is $36.78. That's like an average. So 1% of that is 37 cents. That doesn't sound like too bad, but it's 37 cents times 24 months, which is an $8.88 month late enrollment penalty. So when we add the $8.88 to her $20.90 insurance premium, that's $29.78, and it's an additional $106 per year. That's a nice steak dinner maybe. So Tammy's new monthly premium is $29 instead of $20, as long as she has Medicare coverage. She got paid that the rest of her life. So think of my lady with the many, decades of not enrolling. That's not good. So if you value choice, I'm going to talk about it now just a little bit. There is a better Medicare supplement. First of all, there's a value to working with an independent broker so that you have choices. You have multiple plans to look at. But unlike agents who represent only one company or a limited number of companies, independent advisors, like we are, we work for the client. We don't work for the company. We're not paid by them. So that's how we discovered an innovative plan that a lot of people haven't heard of yet. It's not new. And it's Physicians Mutual, and they're the ones that started this. They wanted to sponsor this thing for us today to do this for Elderwerks, but they've been around since the early 1900s. And they have a rider that can go on their supplement, which is competitive with Blue Cross and Humana and Mutual of Omaha, the other favorites, my previous favorites, but they are the only Medicare supplement in the country that has a preventive benefits rider, which is covering things that are not covered by Medicare. And I'm talking early detection screenings for all those emerging technologies. They've got a patented innovative G plan that no one else has. The patent doesn't run out till 2036 or something like that. It has lower premiums and a much better value. They have a free fitness club membership built in there. You can choose any doctor, any hospital. This is not an Advantage plan. You don't need any referrals. And if you live, travel, or relocate anywhere in the US, there are no network restrictions. Like once you hear about this, I'm telling you, with what's happening in AI, if you don't have a plan that covers this preventive stuff, people are not going to be able to stay as well and live as well and live as long maybe if we can't go for these preventive screenings. It's not for treatment, it's screenings, lifeline screenings, things like thermography. These things are anywhere from $100 to $200. Thermography, a full body thermography is $1,000. Prenuvo is $2,500 for a full body scan, and they pay it. Medicare doesn't pay it, and it is a screening, not treatment. I'm not talking about chiropractic, that's treatment. Acupuncture is treatment. I'm talking screening. Big tech emerging technologies coming up with all these screening technologies to help us live longer and see disease before it happens. That's what the world is going to be about. And we have the only contract between here and Peoria because the regional guy happens to be in Peoria. Just real quick, previously Physicians Mutual only insured doctors and surgeons, physicians and surgeons. Then they opened it up. But just like you buy State Farm from State Farm or Allstate from Allstate, Physicians Mutual only made their plans available through their licensed employees. Well, a year and a half ago, I found out that it's now available through independent advisors, and I still wasn't going to take them on because I'm happy with the stable of companies that I have, and I wasn't familiar with Physicians Mutual, but I am now. They were founded in the early 1900s, and they have this preventive benefits rider that everybody wants. We have not set anybody up with anything other than that in the past year. I do have clients with Blue Cross and Mutual of Omaha and other companies, and if as their renewals come up, I'm trying to see if we can get them in. There are a few health questions. It can be blood pressure, cholesterol, no problem. So it doesn't mean you have to be totally squeaky clean. So it is possible to get in. It's just easier before 69. What's next here? What do I do now? Everybody's got different needs and different situations. If you're in love with your Medicare Advantage plan and it's working right for you, God bless you. I can't, no arm twisting. I won't try to change your mind. But if you're 64, it's time to put a meeting on the calendar with someone, preferably an independent professional who's got expertise in supplements and long-term care planning, because people are going to live longer and you've got to have a plan before the crisis. That's another talk. These are things not covered by Medicare or any supplement. This is non-medical care. If you're already enrolled in a supplement or an Advantage plan, you might be eligible. Answer a few questions, and that's something that we can do by phone, or someone else that represents this plan, which at the moment, it's kind of cool. We're the only ones between here and Peoria because that's where the regional guy is. So open enrollment period comes up October 15th through December 7th, which is for Advantage plans. And during that time, you can get out of their Advantage plan and come with a traditional plan and get a drug plan. Why do you care about 10/15 to December 7th? Because that's when you can come out of Advantage and go into a traditional plan and get on a drug plan. Otherwise, we don't want to be pulling you out of an Advantage plan in the middle of the stream and you don't have drug coverage until January 1st. We don't want to do that. What else do we have? Okay, any questions? Bring them on. You are all welcome. I love you all. I'm so glad you came and listened to this, but you're welcome to a 30-minute conversation with us if you'd like to be pre-screened for long-term care, see if you qualify for a supplement. We are independent and we're not just going to be talking about one thing, but whatever suits best for you. I am certified in long-term care planning and can help you with those things. We're going to give props to Physicians Mutual down there because they helped me with this.